Hey everyone, how are you doing? In today's video, let's look at possible problems you can have with dental implants and how to spot them early and how to gauge the severity of the problem, because we've got two kinds of problems. We've got problems which are quite easy to fix and happen a little bit more commonly, and then we've got more complicated problems which are more difficult to fix, if at all we can fix them, and these are usually more severe, and these are the things that can cause implant loss and things like that. So let's first of all look at what would you notice if you've got a dental implant. What might you notice? What are the early warning signs to make you think, hang on, something's not quite right here, okay? And in all of these instances, if you suspect something isn't right, book an appointment with your dentist and have it looked at professionally. We can take x-rays and do more detailed tests in the clinic environment, and it's less guesswork. But I'm guessing most people who spend a lot of money on dental implants would probably do this anyway. So let's look at the common problems first of all. And by far the most common is what we call screw loosening. This is where the actual crown, the bit that you can see, suddenly becomes loose. Okay, and this can happen over a number of hours or maybe over a number of days. You kind of notice it's got looser and looser. Typically it doesn't hurt, but sometimes it can hurt when you bite. Now the problem, or what's happening here, is that the internal screw which holds the crown down to the implant, that has loosened up, and it's very easy to fix. All we need to do is tighten it up. And if somebody calls our clinic and says, hey look, I've had this implant placed elsewhere and the screws come loose, can you tighten it? We'll always say yes, but we need to know what make that implant is, because so many different implants have all got different kind of screws, screwdriver heads and things like that. So we need to know what the best one is. Now saying this, a lot of people don't know the make of their implants, and we've got a whole bunch in the practice because we've had to fix this so many times for people. Now this is quite an easy thing to fix in theory, and if you've had the implant done by a very reputable dentist who knows what they're doing, they would have made it so it's screw retained. And what this means is the screw access channel is visible from the top of the tooth, and it's just filled with like a white filling material. So all anybody else needs to do is just drill a hole into that without damaging the screw thread, and you've got direct access to the screw. Now the other way of doing this, which is commonly done, but it creates a bit of a problem in retrievability problems like this, is that the crown is put on, then the abutment is screwed into position, and then the crown is actually glued into position. Now this creates a problem because we don't know exactly where the screw hole is, and if it's on the front tooth, the screw hole may be coming out forward, which is why the crown has had to be glued into position rather than the whole thing being screw retained. Now it's not the end of the world, but it does create a lot of issues, and the biggest issue could be that you need to have the crown part of it replaced, which obviously incurs quite a significant cost with that. Now let's move on to a slightly more concerning issue. Okay, and these are issues related to the gum around your tooth and your implant. You see, gum infections and gum problems happen around implants in the same way that they happen around natural teeth. And gum disease is by far the most common dental condition which leads to tooth loss. Okay, so it's something to take seriously. The problem is it doesn't hurt usually until things are quite bad, but there are early warning signs, and this early warning sign is the one that you've heard a million times before, and it's bleeding around the tooth or the implant in this case. You see, if we've got an ongoing kind of low-grade infection, the first thing that's going to happen is that the gums are going to become inflamed, they're going to become red because your body's just trying to fight this low-grade infection. And this low-grade infection can sometimes happen because of the screw loosening, which we've spoken about a second ago, but it needs to be there for quite a long time, because what the screw loosening does, it creates a micro gap underneath the gum where the bacteria sit, they produce all their toxins, irritate the gums, and the gums become red and inflamed. However, they could become red and inflamed for a number of other reasons, and over the years I've seen some cases where people have had implants placed, maybe several implants placed, and only one of them has all of this gum infection and gum problems around it. And honestly, I don't know why that one implant has reacted differently to all of the others. There's one lady that comes to mind, and her mouth was immaculately clean. Everything was perfect. However, she noticed that there was one implant, and it was one of two implants, and two implants were right next to each other, and one implant just didn't feel right, and it didn't feel right for a number of months. And then we took an x-ray and we could see that there was a whole load of bone loss around this one implant, whereas the other one was okay. So I don't know what the problem was there, but it obviously affected one implant more than any others. Now, in these situations, the treatment is the same as if we had gum disease, okay? It's just slightly modified. And what we need to do is clean the surface of this implant. Because the implant surface is designed to be extremely rough to increase its surface area, this creates a perfect breeding ground for bacteria. So we need to actually polish the surface of the implant in order to give it the best chance of success. Now, I'll make another video on the ways that we can treat gum disease around implants. There's no one perfect way, but there are a few, and I think this is something that probably deserves its own video. So that's the first one. Look out for bleeding and inflammation. This is the earliest sign of a problem around an implant. Now, if you let this get worse, quite often what will happen is it will turn into a bit more of what we call a diffuse swelling, okay? It's not so confined. It spreads out a little bit, and if you press on it, sometimes you might see white pus, or it's like a cream colored pus coming out from between the gum and the implant tooth. Now, this is really, really important because pus doesn't just happen. There is definitely an ongoing issue with this implant, and you'd be advised to get it sorted out as quickly as possible, if possible. It could be something as simple as just antibiotics and cleaning it, and which has happened in the past. I've seen patients who've got this pus coming out, and all we've done is actually take the tooth off, clean out inside, and just put a temporary tooth on, and suddenly everything sorts itself out. So pus is one stage further to being a bad problem compared to just inflammation and redness on its own. Now, if we leave this long enough, because none of this often hurts, okay, quite often neither of these two things hurt. So the pus and the inflammation don't hurt. Sometimes they can cause an irritation, it just doesn't feel right, but it's quite often not bad enough to go and see the dentist about, because going to see the dentist takes time out of your day, it's a hassle, and quite often they might not do a lot. So a lot of people leave it, and the biggest problem is we can start to get bone loss around the implant. Now, bone is the only thing holding this implant in your mouth, okay? Just like a natural tooth. As soon as you start losing bone around natural teeth, it becomes more and more difficult to keep it. And again, they only start hurting quite late. So once you've lost a lot of bone around the tooth, that's when things start to hurt a lot more. So when this happens around implants, again, it's a big deal because we can't really stop it from going worse and worse. We can do a lot of things to minimize it, okay, and to increase the lifespan of that implant without having to have it removed and bone grafting and then having a new one placed. If you get to the point where the actual implant itself is loose, okay, not just the crown, so we're not talking about screw loosening, and you can get a feel of this, because if it's just screw loosening and you rock the tooth, it doesn't normally hurt, whereas if the implant itself has lost a lot of bone and you wiggle it around, quite often that hurts, okay? So that's the way that you at home might be able to differentiate how big a problem this is. Once the implant becomes loose, it's going to come out. You have to lose about 90-95% of the bone around an implant for it to start feeling loose. So that's definitely not a good sign. So the best treatment in those situations is actually just remove the implant, let it heal, decide if you want to have another one, and then speak to your implant dentist about the different options you have to have a new tooth in that position. Okay, so I hope you found this video useful. Okay, I will make another one which talks more about the actual treatments which are possible, and I will see you in that video. Okay guys, take care.